Well, I've been associated with the Trauma Society of India conferences for many years. But today at Nagpur, when the first so-called Nagpur Trauma course, it was a pleasant sort of surprise to see the difference. And the difference has come in not only because of the live surgeries, which is seen many congresses, but the fact that each one of the talks given by surgeons of repute is one case. So that brings in a lot of discussion, which is the heart of any academic interaction. A didactic lecture may be good, but most of the times it then becomes an eminence-based evidence. What we are bringing here is somebody of eminence speaking, but lots of people in the crowd discussing what should have been done, what should have not been done, and how things could have been changed. So that's the key point we've had in this meeting.
Okay. So any take-home message you would like to give to the delegates here?
I don't know what take-home message I can give, but I would like to tell them, if they are really wanting to understand, they should follow the principles of trauma management. If you follow the principles, you still could get mistakes, you could still get complications, but you'll get much lesser complications. The next thing which I have been asked about, most of the people who come here and ask me, sir, which implant should I use? Now the message is, that's the least of your problems. You first reduce the fracture and then you see how best you can get stability by the implant, which is chosen after you are able to reduce the fracture. So learn to reduce fractures, learn to understand the concepts which give the stability, and then choose your implants.
And is there anything that you would want in next year's Nagpur Trauma course?
I would like to be invited.
Of course, what you they would do it.
Not really. We've already discussed this in the faculty meeting yesterday. And we've understood that the overlap of surgical procedures, number one, actually takes away from it. And yes, next year we've been asked to perhaps not bring our good outcomes, but bring more of our bad outcomes.
Okay.
So that the youngsters learn from what is happening.
The complications.
Yeah.